Hello, and welcome back to my video series, Ask Derek. As part of being accessible and accountable to you, a little while back I decided to start a series where each month I take a question from my mailbag that you've written in about and answer it. Recently, Dixie in Sequim expressed concerns about some of the cuts President Trump has proposed in his budget, specifically to the National Institutes of Health. In particular, Dixie's worried that it might slow the progress of our fight against cancer. This is something I've heard from a lot of folks about lately, so I wanted to take a few minutes to talk about why this matters. I was very disappointed to see President Trump's first budget blueprint. It's a budget that's heavy on gimmicks, tax breaks to special interests, and absolutely zero progress in addressing our nation's long-term fiscal challenges as a country. On top of that, it makes deep cuts in a lot of areas that we depend on, and as Dixie pointed out, one of the organizations that's really damaged in this budget blueprint is the National Institutes of Health. The NIH is the world's foremost biomedical research institution. The NIH is on the cutting edge of figuring out some of the most challenging healthcare issues facing our country. Last year alone, it supported roughly 36,000 research grants for medical researchers to pursue treatments and cures for diseases such as Alzheimer's, diabetes, HIV/AIDS, and cancer. Now let me say a bit more about cancer. It's a disease that's impacted just about every family I've met, unfortunately including my own. Think about it. Most people you know have a personal story of a friend or loved one who suffered from cancer. And it doesn't matter if you live on the peninsula or in Tacoma, this issue impacts everybody. Now, given its pervasiveness, we need the federal government to be a partner in discovering and supporting prevention and treatments. We should not be slashing research without regard for its effectiveness. So by supporting cutting-edge research, the NIH spurs innovation and improves our knowledge and understanding of human health. In turn, it provides hope for cures and hope for treatments. It provides hope for families. And it's doing things no other organization can do. Their research is vital to improving our knowledge and understanding of human health. This literally saves lives. It improves the safety of our community, and it spurs innovations that can help create jobs. Here at home, research connected to the National Institutes of Health through the University of Washington has also created more than 12,000 jobs in our region. Now, unfortunately, the Trump administration recently released a budget framework that will cause immeasurable damage to this work. Under the Trump budget, the NIH would see a $6 billion reduction, roughly 19% of its overall budget. I'm really concerned about what that could mean, not only for folks in our region, but around the country. Lives are literally at stake with these proposed cuts to this organization. Now, I'm going to continue supporting the Institute's mission, along with the National Cancer Institute. As vice-ranking member of the Appropriations Committee, and as a co-chair of the House Cancer Caucus, I'm working hard to ensure we provide stable resources in this arena. And going forward, I'm going to continue to push back against the President's proposal. And I'm going to support our medical and scientific research communities. The fight to save lives is too important. So thanks again, Dixie, for writing in on such an important topic. And to everyone else out there, keep the mail coming.